Good afternoon, everyone. And I think we had a really engaging first 1.5 hours of our today's event. We did indulge and delve into how climate and health distinctly linked to each other, and we cannot compartmentalize them as in different silos, as different sectors, but they need to be understood as one holistic goal. This panel particularly now comes the means and the mechanisms how we can deal with this, and how we can somehow think of innovative ideas or alternative mechanisms of financing, and what examples or best practices we can learn from each other as far as funding or pumping money for climate and health objectives are concerned, and also how we can deal with how we can help or facilitate the vulnerable communities, the communities that Prabhatji mentioned about children, gender, women. So there are different aspects, different elements that we wish to cover here. Our time is limited, but we'll focus more on financing and channelizing or mobilizing investment for this sector. We have a diverse panel, diverse speakers today who come from different sectors. We have somebody from the corporate, somebody from philanthropy, and also someone from the Multilateral Development Bank. The format is simple. We'll quickly go through 2 rounds of discussion. The first round will be more of introducing yourself, or how you look at this challenge. How do you look at financing as a major bottleneck as far as funding the sustainable development goals are concerned? Indo-Pacific is a huge geographic expanse, I understand. But let's look at India for the time being. Since we are sitting here and we understand that the Indian economy is somehow, gaining all the limelight for all the right reasons in current times. And we are anticipating the economy to grow even further as we progress. But at the same time, we are sitting at this juncture where, we have to think about sustainable development goals and chart a way after 2030. At ORF, we keep discussing this, what is our post-2030 agenda that we can think of? What is the roadmap? And here in post-2030 agenda, there are 17 sustainable development goals and 164 targets. But how are we going to finance them? That's one question that we'll try to identify and think about in this panel. So I'll begin with Dr. Joshi here. Dr. Joshi, considering you come from India Health Fund, and you've been working there for quite some time, and you have a extensive experience in this sector. In your perspective, how do you look at the current state of affairs as far as financing for climate and health resilience in India is concerned? And if I ask you to identify the imperatives and the priorities or the challenges in that sense? Over to you, Dr. Joshi.
Thank you, Swati, and good afternoon, everyone. So just by way of a little context, India Health Fund was set up by Tata Trust back in 2017 with the announcement of the Sustainable Development Goals. Now, there were specific goals for the elimination of infectious diseases. And by then, India had also announced much more ambitious goals to eliminate TB by 2025, malaria by 2027. Tata Trust needs no introduction and has a long history of institution building in the country. Tata Trust also has extensive experience in running programs for healthcare. And the trust took the view, based on their own experience, that achieving these elimination goals would be very challenging only through programmatic approaches. And that was not a reflection on the quality of the program, but it was more about the scale of the challenge. And science and technology was identified as a potential disruptor, which could provide the discontinuity that programs needed to really come closer to the elimination goals. But the related hypothesis that Tata Trust had was that market failure had prevented the application of meaningful science and technology to develop innovation addressing infectious diseases. Very different from what was happening with non-communicable diseases. So if you think about cancer or diabetes or cardiology, there have been big investments made in therapeutics and diagnostics and adherence, all of which have made a significant difference to patients' lives all over the world. That is not the case for infectious diseases, not because the science doesn't exist, but because over time these have become diseases of the poor, funded largely by governments or not-for-profits, so there wasn't enough return for the private sector to make the investments relative to the returns that they expected. And that's not a reflection on the private sector as well. That's how incentives in healthcare work. That's why Tata Trust set up Conceived India Health Fund, intended to be a catalytic fund which would provide the patient capital which was needed but not available to the developers of innovation based on strong science. And not just provide the patient funding, but to also be catalytic in enabling the partnerships and collaborations that were needed to not just develop these innovations, but also scale them in India and other developing countries. The philosophy Mr. Tata had, well, the late Mr. Tata had, was India for the world. You leverage Indian science, Indian entrepreneurship, and most importantly, the design for value capabilities that India has to develop solutions that are contextually relevant to the conditions in developing countries. So that's how, a little bit of context to India Health Fund. And that's, I think, the run-up to your question on the state of financing. India Health Fund was set up because there is no funding mechanism for communicable diseases, and all communicable diseases are climate sensitive. And that's the truth in India. It's also the truth in other parts of the world. So India Health Fund is the only privately, philanthropically led initiative anywhere in the world that is leading the development of meaningful innovation addressing communicable and climate-sensitive conditions. There is funding available, but most of that is through government. There is considerable grant funding available for science. Where the funding cliff starts is at translation. Meaningful science developed. How do you apply it to develop an innovation? And that is the so-called valley of death that we focus on. If there is meaningful innovation, there is a meaningful prototype that needs development, we will finance it. Funding for the private sector does not only require grants. The private sector also needs working capital. The private sector needs equity. Now, this is another funding gap in the country today. There was a very promising blended finance facility that existed. Unfortunately, that is now shut down with the closure of USAID because it was USAID backed. So we are now in the process of trying to enable other blended finance facilities, because there is a crying need in the private sector for it, particularly in public health challenges. And then the larger question becomes, public health is provided by government. So the government as a user is non-negotiable. The approach we have taken is that anything we fund is based on problem statements and need gaps identified by public providers. And there is government involvement in the selection of what we evaluate. If government greenlights that as a potential solution, we put it financing for it. However, government, again, only works on evidence, and that is the right thing to do. So government procurement and government scale can only happen when solutions provide the necessary evidence to demonstrate good public health outcomes as well as cost effectiveness. And that is an area that I think we have catalyzed effectively in one of the areas we work in, which is tuberculosis. Climate and health on the adaptation solutions, on the other hand, are at a much more early stage. And this is where we believe that the catalytic approach we have taken on some areas can now be applied to climate and health. And I'll stop there for now.
Thank you, Dr. Joshi. I think a very important point you raised there was how, it's not the fault of the private sector for not investing in, communicable diseases or infectious diseases. You need to read between the lines there. So I'll bring in the aspect of adaptation here, climate adaptation. That's one of the major bottlenecks, adaptation financing that vulnerable communities in the Indo-Pacific are facing. I'll go to Vanshika since she works with a multilateral development bank, and we understand that Vanshika, adaptation financing is meager. It's dismal, and most of the funding from the MDBs or these public development banks is diverted towards mitigation. And there is a greater need to leverage resources for adaptation in general. Now you work with AIIB, and you have been with the ADB for quite some time. In your perspective, how do you think can the regional and multilateral financial institutions, what role can they play as far as expanding access to funding for climate health adaptation is concerned? And maybe delve a bit into what Dr. Joshi said. How do you incentivize the private sector here? How do you involve them? And how do you bridge this gap between public-private partnership? Over to you, Anshika.
So firstly, a very good afternoon to everyone, and it's really a pleasure to join. And thank you to ORF for inviting me and for hosting this very vital and timely convening. To kind of address the question you've posed and to provide further context, let me actually kind of lay out a bit about the climate and health landscape, how financing is coming up in that ecosystem, and the role of MDBs at large, because some people may or may not be aware of what MDBs are, what their role is, how they come in to the picture, and so on. Multilateral development banks are at the intersection of finance, development, and diplomacy. They are uniquely empowered with the jurisdictional mandate, authority, and trust to invest directly in member countries. We have, of course, we know of like the World Bank, the Asian Development Bank, AIIB, which is the world's youngest multilateral set up in 2016. So institutions such as ours kind of have an inbuilt supranational structure and nature that gives us the legitimacy to drive development where many players can't go, and have the risk appetite and provide that patient capital for infrastructure development, for social and environmental development, and so on. If we look at AIB in particular, it's now this year celebrating its 10th year, and as a new bank, it's been very future forward in the kind of thematic areas and strategic priorities that it has. We have 4 major thematic areas, which includes connectivity and cooperation. We have technology-led infrastructure. We have private capital mobilization, and we have green infrastructure. So that is inbuilt in our mandate. We also have very high, commitments and targets in place. For instance, we have already 67% of our portfolio already is catering to projects that have a high climate component. By about 2030, the bank will be investing USD 50 billion in climate finance and action. In 2023, we had our climate action plan that was launched. And last year, we had a new instrument, which is a climate-based, climate-focused, policy-based financing that has come in. So we have a few projects, including in Bangladesh and in other countries such as that are coming up in other member countries across different continents and the Indo-Pacific as well. So for those who may not know, this is a little bit of the context in terms of what an MDB is, what it does. And in terms of financing and lending, there are 3 particular forms of lending and financing. And I'd like to throw light on it because I feel a lot of people don't know about it and don't know what the procedure mechanism is. We have 3 particular forms. First, we have project investments, which are structured financial and technical commitments made by the institution to support a very specific initiative, typically led by a government or a private entity or a public-private partnership that advances sustainable development goals in a member country. The second is result-based financing that an MDB provides, where the financing approach is where disbursements are made only after agreed upon results or performance targets are achieved, rather than funding inputs or activities upfront. So that's the second. And third, we have policy-based financing. So that's where the MDB comes in and provides direct budget support to a government in exchange for implementing specific policy and institutional reforms. So unlike project financing or the PBB, the policy-based financing is not tied to individual investments or infrastructure, but a broader set of policy actions that promotes economic stability, social advancement, government improvement, structural change. So it's really about enhancing systems at large. And that's where an instrument such as our CPBF, which was introduced last year and is being really scaled up, plays a major role, because in one go, it's a huge package of solutions with a large a financial envelope that is being provided to countries for meeting their climate transition pathways, both both in terms of climate adaptation and in terms of their low carbon and mitigation efforts. And I'm happy to go into that in further detail later. So that's a little bit in terms of our financing mechanisms. I would also like to add that at large, be it a climate focused project or not, MDBs are very climate first. And I think this is something people don't realize. Be it in our corporate governance, vision, mission, targets, our environmental and social safeguards, the nature of procurement, there are very high standards that have to be met. And therefore, actually, when projects are being designed and negotiated with client countries or member nations, they have to really meet these very high standards. And therefore, from kind of start to finish, that we are very conscious about that. Third, I'd like to bring in a point in terms of the role of MDBs from upstream, midstream to downstream activities. MDBs that way, given that we do a whole bunch of things while financing and projects is at our core. We also have departments particularly looking at knowledge production, right? And looking at what are the new emerging areas and agenda points and sectors and new intersections. Within that, the climate and health intersection actually has been, I would say, a huge product of the MDB movement. And for more context to the members, from 2020, 2021 onwards to where we are now, it's been a long journey. In 2021, the UNFCCC at Glasgow, that was the first time there was a half day for the climate and health intersection. And in COP28 at Dubai, that was the time that there was a dedicated health day. And besides that, they have been at the G7 and G20 level, huge commitments. So be it in terms of the declarations or be it in terms of other financial commitments that have come up. So this has been, where we are is really a product of the past 4 to 5 years. I just wanted to bring that for context. Now, along with that, but why has that been the case? Why has health been such a laggard? That's because within the climate conversation, the spotlight has always traditionally gone to sectors such as energy, transport, and industries. And the social and human development aspect has always been left behind, since it's been a do no harm good sector, because the private sector has not looked at it. There is not the motives and incentives aren't aligned in that manner, and therefore it's kind of been this it's kind of been an orphaned sector in that sense. But now we see that there's been a huge change over the past few years. I'd also like to bring some data to reflect this intersection. While we all know more about the climatic impact on health in terms of the fact that climate change has impacted public health by almost affecting 5.6 billion people, costing about 1.5 trillion over the past 30 years, it's estimated to push more than 100 million people into extreme poverty by 2030. We don't think of the other side of the equation, which is the health sector's impact on climate. And if the health sector were to be a country, it would be the fifth most polluting. And at this point, it accounts for approximately 5.4% of net global emissions. If under business as usual, we were to go on, health sector emissions would triple by 2050. The reason I bring this out is because we have to parallelly look at climate adaptation and mitigation. Of course, for countries in the Indo-Pacific and the global south, climate adaptation is the key focus. But for global north countries, climate mitigation is critical. And if you look at a lot of the country commitments, they are already on that pathway of low carbon commitments and decreasing their emissions, be it at the health facility level or beyond. The other point I wanted to bring in is that, the health sector and whatever, in this case, the intersection we're looking at, 80% of health outcomes are a result of the conditions outside of the health sector and not within it. So the intersections not only in climate health, but other areas such as nature, such as transport, so on, become very, very important as well. Now, having said all of this, I would like to bring in the role of an institution such as AIIB. This year, we celebrate the 10th anniversary, and AIIB has been taking a lot of efforts, be it agenda setting or be it projects, in the form of various plans, sector strategies. I'd like to highlight our climate action plan that was launched in 2023. We have our health sector strategy, the bank's first health sector strategy that was launched last year in 2024, and then our annual infrastructure financing reports that our economics department comes out with. We had the Nature as Infrastructure report in 2024 and the Infrastructure for Planetary Health report in 2025, which really talked to the climate and health intersection. Now, within this, I would like to go a level further where climate and health is the intersection, of course, and that's how most of the institutions are framing and looking at it. But at AIIB, our kind of thought leadership value and addition here is that we framed it around planetary health, infrastructure for planetary health. How do we look at the climate, health, and nature intersection? And what does that mean? Because the degradation of this trisection is critical from, of course, extreme temperature, vector waterborne diseases, emerging zoonotic diseases, air pollution, and so on. And therefore, nature is something we can't not look at. Within this, we have 3 specific key investment areas that have come out at a more upstream agenda level that we're now trying to downstream through projects. And these include the following 3. Firstly, investing in green infrastructure, including accessible, green, resilient, and inclusive healthcare infrastructure. Secondly, opting for a health in all infrastructure approach, especially since a lot of the development banks traditionally have started off and have a huge portfolio in transport, energy, and only as they've grown and matured do they move towards the social infrastructure bucket and portfolios. Along with that, to the point that I said earlier, that a lot of the health outcomes lie outside the health system. So looking at health in all infrastructure becomes all the more paramount. And thirdly, to view nature as infrastructure and really bringing in nature-based solutions as we design and deliver projects. So those are in terms of 3 key, principles and investment areas that we're looking at. We have several projects, and I'm happy to go into that, where we're really looking at human and natural infrastructure systems in this intrinsic manner to unlock not only what we always call co-benefits, but what we want to look at co-benefits. We have projects in Cambodia, in Kerala, in India, in the Maldives, in the Pacific Island nations, and I'm happy to talk about that further, perhaps in the next round. Thank you,
Anshika. Thank you for comprehensively laying out what the bank is all about and what MDBs practically do and how they deal with financing and what are the modalities involved. I mean, this was very useful and helpful for some of the young audience that have joined us both virtually and physically. But I'll come to the examples and the best practices if you can share that with us in the second round. I'll come to Antara now. Antara, you work with PwC and you have a different background from Dr. Joshi and Vanshika in that sense. And from a corporate sector, you are dealing with both public and private sector clients as far as building climate resilience strategy or community resilience is concerned. We did discuss community resilience in the first panel, but from a UNICEF perspective or from a PHFI perspective. But in your perspective, from a financing and add a financing angle to it, how do you look at it? How do you look at building climate resilience is important from a financing perspective towards climate and disaster hazards or towards adaptation, which Vanshika was talking about, nature and ecosystems. Over to you.
Thanks, Swati. Thanks, everyone. Would just like to take a minute to introduce myself. I'm Antara. I've been with PwC for over 14 years now. and my background is environment and climate change, but I've been working with the urban sector team, so mostly the team which works with cities and city governments, and it's a team. Apart from me, most of the other people in the team are architects, planners, civil engineers, and then over the last 7 to 8 years, we kind of carved out a practice around climate resilience, and we started inducting people from the social sector, from health sector, from other sectors, because resilience and adaptation, they require a much more cross-cutting, multidisciplinary approach, and that's a little difference with respect to mitigation, because mitigation it's mostly climate change, energy, and it's a little homogeneous in nature. So that's the flavor of our team. I have 2 members from my team here, and we have been driving the agenda around climate and disaster resilience from PwC in India and across. And also, we do a lot of work around climate finance, helping city governments access climate finance from various sources and means. We essentially help work with them to create a pipeline of projects and ensure that the kind of infrastructure projects they are designing are climate positive in nature and also climate adaptive. Yes, like Swati said, I work both across governments. We've done a lot of work with IDAs because most of the adaptation action has been, kind of led and spearheaded, like Vanshika was saying, through the ADBs and the World Bank's AFD, of course. GIZ, we are doing work with GIZ right now, and also with the CDRI, so Coalition for Disaster Resilient Infrastructure. With them, we work across various sectors, helping them, bring in disaster and climate resilience with respect to all kinds of critical infrastructure. So not just health, but telecom, power, roads, railways, all of it. So yeah, and the beauty of it is, the accepting the intersectionality and the interdependence of the various critical infrastructure sectors that are at play, because resilience action is about building resilient systems, not just building one resilient infrastructure. So I think that's what we've kind of seen when we've been working on the ground. We've come up with a resilience, telecom resilience framework. We've come up with a coastal cities resilience framework where we kind of identified there are 6 pillars, and all of it is interlinked, and it not just health but livelihoods, and all of it is kind of the key drivers, of course, are public governance and how governments are governing, the funds which are being allocated to adaptation finance. We are currently, and you spoke about India, Swati, and how India is dealing with things and how I've seen it, because I've worked in India on resilience for the last 14 years. There is a sea change in the government approach from what I've seen even 5-6 years back, pre-pandemic and post-pandemic. There is a sea change in the way governments have also realized that there can be very quick action that can take place. The importance of private sector coming into scale, and that the fact that private sector financing, private sector in general, has the capability of doing something faster, replicating something very fast. So that is a realization that I've seen because I work very closely with governments. And the other thing is that because India has been receiving these kind of TAs and grants for so long, they have built capacity. So now the kind of capacity that we now see currently within the governments, within the line ministries, when we work with them, are not the same as we used to kind of find about 5-6 years back. So that's another positive thing that we are seeing. And building on that, we are currently working with the Department of Economic Affairs to help mainstream resilience in certain infrastructure programs across the life cycle. So whether it is ADB funded or not, public money is going into it. And I think there is the DEA feels now that there is no reason why they should not be incorporating the same principles of resilience and mandate resilience building into the infrastructure that is being created, because a lot of public funding is going to be pumped into this in the next 3-4 years. It's also economic infrastructure and social infrastructure, all of it put together. So we are working closely with the government on that, and is starting with 3 line ministries, and the hope is that because from the policy push that will come, the mandates that will come, it will get mainstreamed over the next few years across line ministries going forward. Quick point of view on what Swati was asking, coming to finance. Now, we are talking of course, catalytic finance and blended finance mechanisms. And of course, getting in public sector, private sector interest is a challenge, but an opportunity at the same time. And we are having this dialogue now. I think 2 years back, we were not even having the dialogue of private sector interest in this field. So I think that is a big step, that private sector is getting interested, and they are seeing there is a reason why they're getting interested, right? Because these kind of dialogues are happening. Both what Mr. Madhav said and what the IDs have been doing for a long time, and what impact investors are now planning for. It's all part of catalytic finance. It is not a substitute to mainstream finance, which is still lies with the government. And we know that the government, specifically in Indo-Pacific countries, the Asian countries, when we saw the percent of GDP, in terms of government spend towards health sector, that is really, that's less than half of what, say, France or US or Australia is spending. And that is still, there is a lot of ground to be covered there. And that's the kind of, confidence that even the catalytic capital, whoever is investing it, would like to see that the counterpart financing is also kind of up to speed and, up to that same level. That's number one. And number two is also the point of governance. And we've seen that, well-governed money will always attract, more money, whether it is from private sector or whether it is from the people who are providing catalytic capital. So I think, the way the money has been governed, successfully in certain states or subnational governments is what has made the difference in terms of, how resilience, how well they have kind of leveraged whatever they've received, and they've actually built more resilient systems than some other subnational governments. So that is, I think I would like to stop there. I'd just like to say that I think the point of governance is extremely important when it comes to managing finances. It's a little bit like our household, right? When we know that there is limited capital available, or there is uncertainty towards what we are going to do next if a USA kind of shuts down, then we'll need to figure out ways of managing what we have and to make a little money go a long way. So I think I'd like to stop there. Swati, thank you.
Thanks, Antara. I would like to pick one point where you mentioned that impact investing alone cannot be the medium for, plugging the financing gap. It has to supplement public finance. Let me use that as a segue for the second round with Dr. Joshi. There's this report I read last year, and we also wrote a short piece for ORF, how philanthropy can possibly unlock development finance. Can that become a new normal? And there's this figure which says that we understand that the SDG financing gap has tripled from $2.5 trillion to 4.5. And this report states that the private wealth at present stands at $454.4 trillion. And by the end of 2027, the same is expected to rise by 38%, touching almost $629 trillion. So in this sense, we argued that if we can essentially mobilize even less than 1% of that private wealth, our, SDG financing gap, maybe, we would be able to address that. Put it very simply, not possible practically. But what do you think, since you come from that sector, and since Antara mentioned how impact investing alone cannot be the solution?
So if only it were that easy, we'd all be, I think the world would be a better place. But I think to your point on philanthropy has, I think, a key opportunity, which is the ability to take risks, which private finance, government, and multilaterals cannot. And that's the role that philanthropy is playing. And that's certainly the role that Tata Trusts have enabled through the India Health Fund. And I think coming back to climate and health, I think that's the approach that we are trying to take. We recently closed India's first climate and health adaptation challenge, which was an open call for proposals for developers of solutions that were addressing two priority issues as far as climate and health adaptation goes. One is solutions for heat adaptation, and the second was diagnostics and surveillance solutions for climate-sensitive infectious diseases. Because if you don't diagnose, how do you treat? So we prioritized these two areas, and this was an Asia-focused initiative. I'm not at liberty to share with you what's come out of that yet. I'm under a gag order there, but I can share with you the approach we took. And this is, I think, to your point on the role that philanthropy can play. We did a fairly comprehensive assessment of what climate science and climate data is pointing to. We then triangulated that to the existing and emerging health risks. So to make that, to give you a few examples, rising temperatures are leading to a shift in mosquito distribution patterns, which is leading to outbreaks of mosquito-borne diseases at different intensities in different geographies. Some places that had never experienced dengue are now experiencing dengue and malaria. Some places that are experiencing outbreaks at times of year when they never happened. And that's all because of changing temperature and rainfall patterns. Now, there are implications of that from an adaptation point of view, because unfortunately, this is not going to go away. Which means that solutions are needed today. So that was one of the areas that we had put out, and we're in the process. I can talk about one of the solutions that we are already funding, which is, it's ingeniously simple. It's a system of traps, which attract mosquitoes. The traps have sensors built into them. Now, what I've learned is different species of mosquitoes have different wing beat frequencies. And the sensors have been trained to read the wing beat frequencies, and AI algorithms have been trained to detect species based on the wing beat frequency, and different species carry different diseases. This has been done. It is being deployed in Bhubaneswar as we speak in order to get real-time information on concentrations of disease-carrying mosquitoes as they happen, so that vector control authorities can undertake not just vector control, but also identify breeding sites. And this is to the point that was made earlier, the need for hyperlocal solutions, because these sensors are literally in a 3-kilometer radius. So that triangulation is possible. Now, to make it even more interesting, satellite data is being incorporated into this to identify vector control sites. Now, this is an example of how emerging science climate science is being triangulated with health implications using frontier technology to develop solutions which are relevant for public health. And this is what nobody would have touched with a barge pole except for philanthropy. So that is the role that philanthropy is playing today, to develop, de-risk, and demonstrate. And that's why Bhubaneswar is deploying it right now. But that's not the end. The role that philanthropy can play is to develop bankable solutions that can then be scaled by governments and multilaterals. And that's, I think, to the point that Vanshika was making. Now, this is all being done through the private sector. We need to make sure that this is viable and sustainable for the private sector to continue to invest, because grant funding from us can only go so far. And that's where then the role of debt and equity comes in. And that's where impact investors, and that's where the 1% that you spoke about can potentially play a role, because that's where impact investing has a role to play. And this is what we are now trying to scale through a number of the other climate and health related initiatives that we are running. Because I think what we've also seen is climate science is emerging and climate data is emerging every day. Health science is well established. The triangulation between the two has not necessarily happened from a developer point of view. And that's what the one takeaway I can share from our recently closed call for proposals. We will have to customize and almost curate the development of solutions for climate and health adaptation as of today. We anticipate that in the coming years, more developers, more scientists, and more researchers will start applying the science that they are developing in labs to translational research to develop solutions. That hasn't happened yet. And that's the second role that philanthropy can and has started to play, at least from India Health Fund. We are now actually identifying what solutions are needed and actively seeking developers for those solutions so that we can then finance their development and the evidence that is needed for their scale. So that's, I think, the potential for philanthropy. It's an exciting world, but it's a challenging world because there's a long way to go.
No, I think you rightly put it, how philanthropy can take the risks and develop and demonstrate scalable solutions which can be funded then by MDBs. That brings me to Vanshika. Vanshika, in your first round, you touched upon how AIIB, what instruments does it utilize and what best practices or projects it has started. If you can explain that a bit and maybe add how does an MDB look at philanthropy? And these projects or these solutions or these development of projects by philanthropy, how does what role can MDB play here to utilize it in an appropriate manner which is scalable?
Thank you for the question, Swati. So to that, MDBs, I would say over the past, I would believe 5 to 10 years, there has been huge momentum to have greater engagement with the private sector, with the philanthropic capital. But before that, even greater engagement within the MDB community itself. That itself has been, I think, a very positive advancement over the past decade, where we now see that the major MDBs come together, meet regularly, at least once a quarter, where all the presidents meet and align and look at what are the areas that there can be joint action for. I would like to highlight that on this front, actually last year in June 2024, the development banks came together and came out with a joint roadmap for climate health finance and action, where actually AFD, World Bank, ADB, AIB, AFDB, EIB were all, and so on, were all part of this, where they have laid out an understanding around what are the climate health investments, on identifying country regional vulnerabilities, where are the needs, and the gaps and so on. So just to highlight that, firstly, even that within the MDB community, them coming together, that is a new development, which is a very positive one. Second, when it comes to private capital mobilization, especially for I think newer MDBs such as AIB, within its goals itself, right from the beginning, it has stated that it looks to have at least 50% of its financing coming from private sector sources by 2023. Since 2016, the bank has mobilized, a huge corpus of funds from the private sector for infrastructure development through different kinds of also asset-backed securities and different forms of partnerships. So that's something that at least AIB is very proactive in. And then, of course, using catalytic financing to de-risk projects and to attract more private investors. So, for instance, in Singapore, AIB is invested in an infrastructure private capital mobilization platform, which purchases infrastructure debts and distributes them to institutional investors. And this approach has helped build infrastructure as an asset class, and to support private capital mobilization here. So there are several things that are happening, and also, structurally, to give you a little bit more flavor of the MDB mandate, at least in AIB, we, for instance, my particular department, which is public sector clients, financial institutions and funds, we have dedicated teams looking at sovereign financing and non-sovereign financing. So even institutionally, we have those structures in place and teams working on these different mandates accordingly, and converging, of course. So that's a point on that front. The third is that, how do we work with the private sector, build more public-private partnerships, and bring in philanthropic capital for different kinds of investments. In this case, we're talking about climate and health, right? And I think the biggest challenge now is, now that the area and this thematic area is matured to a good, is maturing and it's not nascent anymore. What are the best buys? What are the project typologies? How do we prioritize where different phases of funding should go? And in this attempt, actually in my previous institution and currently, I've been working to really see with the larger team, how can we look at some of the health system building blocks, namely by this I'm referring to WHO's building blocks, through the lens of leadership and governance, human resources for health, health information systems, essential medical technologies and products, service delivery, and health financing. If we look at these 6 WHO health building blocks, what can be some of the best buys that are there and the project typologies? And this is an ongoing process that we are undertaking as we really move towards midstream and downstream pilots and projects. And here, be it digital platforms, be it new tools, be it a lot of innovative entrepreneurial ventures, we have a lot of work that we're doing to identify these and kind of doing that due diligence, that which are the entities that the bank can come in and really scale through a large project. Along with that, I've been very excited to see that there's also a lot of technical assistant grants and funds that are coming up. And I recently, for instance, came across one such fund. A lot of momentum here as well. And I would like to say that also helps a lot of the MDBs, which otherwise when they come in, the financial size is huge. A project can be 200 to 300 million on average. You have projects going up to even 1 billion plus. But while there is concessional funding, or some of the newer banks also, that is a different model. So TA and funds and grants really help. So to all the other panelists and stakeholders there, I think this is a joint. The whole ecosystem has to come together to solve for climate and health. Along with that, I wanted to mention 3 particular areas. One is, I just wanted to bring to notice, since a lot of talk was also around heat, is that we also have a larger heat and health investment framework. This is something I was working on during my time at ADB, where we wanted to see how can we come out with an investment framework. And this is, again, in the next few months, you will see a lot of content, a lot of material coming out on that. The post that I wanted to I highlight 2 particular projects, and this is from my current role at AIIB, which touch upon different areas. So one is a project in Cambodia, which is a cross-border livestock health and value chain infrastructure improvement project. The other one's from India. So let me actually touch upon this a little bit to showcase the kind of project objectives and what are the outputs and the activities. What does that look like? So this particular project aims at strengthening animal and human health safety and promotes cross-border livestock trading among countries in the Greater Mekong sub-region, including Cambodia, Laos, Vietnam, Thailand, and China. And based on the One Health approach, it has multiple elements, including construction of a vaccine center, establishment of a disease control centers to strengthen the prevention and monitoring systems of animal and zoonotic diseases. Secondly, it entails refurbishing the National Animal Health Research Institute, provincial and animal health laboratories, and relevant facilities to upgrade diagnosis and control functions of the diseases. Or it entails the establishment of a livestock value chain infrastructure with high standards of hygiene and sanitation. Fourth, it entails the enhancement of policies and regulations for better health, safety, supply, and trade in livestock and livestock products. And fifthly, it entails the operation and management of the overall project. So the reason I thought it'd be good to go into a little bit of the project description is that, sometimes I think people don't realize or don't have the insight on how comprehensive, when an MDB comes in, how comprehensive the project has to be when it's designed and delivered. So that's one project from Cambodia. India. And quickly, another project that I would like to highlight is from India, which is the Resilient Kerala Program for Results project. And this is to enhance the state of Kerala's resilience against the impacts of climate change and natural disasters, including disease outbreaks and pandemics, especially in light of the 2018 Kerala floods, which were the worst it's ever experienced in its 500-year history. This is actually a project co-financed with World Bank and the AFD, and is a program for results model. Some of the areas where the program specifically looks at include strengthening the transversal systems for resilience, embedding resilience in key economic sectors, and looking at the whole host of priority sectors within this: health, road, urban, water resources, agriculture, disaster management, and fiscal and governance aspects as well. I can even go into some of the activities, but I'll maybe pause there. But again, very beautifully designed, where we're looking at strengthening the resilient core road network, to strengthening financial protection against disasters through sustainable fiscal and debt management, to strengthening public health systems against disease outbreak and natural hazards. So really to showcase that there's a lot of thought, at least a year and a half to 2 years sometimes is spent on just designing the program and project, and to have country ownership and ownership from the partners as well before it then goes into delivery, which then itself is at least a 3 to 5-year journey.
Thanks, Vanshika. I think you comprehensively laid out what projects AIIB has been doing or plans to do, and also the details about the how these projects are designed. But one thing I found very important was coming together of the MDB community is critical. So even if one bank is doing something in a certain sector, it requires other participants or other actors to also engage in that direction. That brings me to Antara, and that will be the final round question for this round, and we'll open the floor because I want people to also engage with all three of you. Antara, since you mentioned about how you've been working with community and how you have been dealing with them, maybe you can quickly share some of your best practices from your sector. Since Dr. Joshi here spoke about India Health Fund, and Vanshika detailed about AIIB, an idea or a perspective from the corporate would also really add to the discussion. Some quick best practices from your side.
Okay, and then again, I'll be India specific because this is, worked across states at the community and grassroots level as well. And I've seen, a lot of things we just assume that things are probably not happening, but we'll be surprised when we actually go to the field to see how well coordinated, the districts, in fact, because adaptation action in the rural areas are being governed by the disaster, the district authorities, how well coordinated their action is. And it's much better than what I've seen in cities, to be honest. Even in the city that I am, we've done a resilience roadmap for Kolkata, and we've also, worked in slums here. But the level of coordination that we probably see in the rural areas is much better, because I think the governance mechanism, the coordinated action at that level is probably, it's a much more, better coordinated, I would say. And that kind of coordinated action is very important when, because, a community is resilient if during the disaster or during the extreme weather event, they are able to withstand it, not before, not after. That is the test of resilience. And during disasters, it gives very little time for action, right? And if that coordination is missing and that time is lost, then the turnaround time is very important. And that is the measure of resilience, which I found, better in rural areas, whether it be Bengal or Bihar or everywhere else. I think they've just learned to be fast. The other good practice, of course, in terms of governance, we were talking of policies and how important, policy enforcement, how important it can be in actually creating impact with respect to community resilience is, of course, Odisha. Everyone knows about Odisha. I mean, it's well spoken about, but I've seen the impact on ground when I've actually spoken to multiple departments, line departments in Odisha. Some of them lament about it that, say industries, we are not prioritized during a disaster because our state has a zero casualty policy. How they implement and enforce it on ground is the moment there is a disaster warning and an emergency is declared, the state policy is enforced, and that means that power supply and all these critical infrastructure, the critical services are prioritized for the critical infrastructure services, because beginning with health and evacuation and everything, people come first, and therefore everyone else will be kind of deprioritized, and that is how they have been able to achieve absolute zero casualty. And I think that is the true measure of community resilience. At the end of the day, your infrastructure can be resilient, but if people are getting impacted, then it's not really meeting its purpose. So that is, I think that's a wonderful kind of example, and I think other states are kind of trying and emulating the same thing. It's a brilliant example. And the third thing is more on localized, and not a lot of people talk about it, but it's Surat, because it's in Surat. They have really learned from the plague, and they have they were the first people as government to identify the interconnectedness between climate and health, and take early action. And they were the first people to come up with the concept of heat action plans, and not just heat action plans lying on the desk, but actually being implemented. They came up with there is an agency called the Urban, I think, Climate Resilient Health Center, and that center is under the aegis of the government. It was, I think, led by Dr. Vikas Desai, who was then the health director, and I think that center still exists. It continues, and they kind of work at the intersection of climate and health for a long time. They also have an app. So Surat has this citizen app where and it has had this app for a long time, when citizens have been getting this climate alert, health alerts, epidemic alerts, and so on. So I think that is one brilliant good practice that I've seen. It's very easily replicable. Yeah.
Thank you, Antara. I think you brought the domestic or the national aspect of resilience and how best practices from grassroots level can be replicated as a template. I'll open the floor for questions. Any quick questions before we wrap up the session?
I have a question for Vanshika. You have mentioned about climate focused policy based financing, right, in your talk. So I just wanted to ask, have you seen because you've been a part of ADB before and now you're working with AIIB. So have you seen a change in perception from government policy perspective across third world countries in the Indo-Pacific region before and after the pandemic era? If you've seen a change, can you talk about it in a brief way? Thanks.
Thank you. I think we'll collate all the questions and then go to each speaker.
I have one question to Vanshika. I'm Shubhati Banerjee Chaudhary. I'm an author, researcher, and a columnist. That you mentioned about a due diligence technique relating to this particular climate and health finance. Any particular technique which, if you would like to mention?
I have a question in general. I hope I'm audible. I just wanted to understand in development finance, how is the problem of ground level leakage dealt with regard to, because obviously it impacts both the efficiency as well as it harasses the feedback loop of results, which then harasses more finances coming in. So how can it deal with the problem of leakage at the level of the recipient of the finance? Because it is not always criminal, because that is also another way of short-term resilience that they are doing. So then how do you negotiate between someone, say, selling the vetiver grass that has been given to them for soil erosion and all of that, because they need to feed themselves right now? So how is that problem? Can it be dealt with, and how is it dealt with? Thank you.
Thank you. I think we have one more question.
So basically, I have two questions, one for Joshi sir and one for Antara ma'am. So for Joshi sir, I will ask, how can philanthropic structures ensure that research they fund, especially in fields of medicine, remains accessible and affordable to marginalized communities? And to Antara ma'am, my question is, how might philanthropists better coordinate with the government and international bodies to maximize the global impact of research funding? Thank you.
Thank you.
My name is Shreya. Yeah.
Thank you. I think we'll go to Vanshika first with the two questions that were directed to you. Would you like to take that up, Vanshika?
Yes.
How do you perceive, the difference as far as working with countries from the global south after the pandemic? I think that was the question about.
Right. Yeah. So they were like three questions, those three, and then the question even on like leakages and how to check that, which I thought was a great one. So let me just one by one, I'll try and cover them. So the question on due diligence, I mean, honestly, for that, there is no one technique because the bank has multiple processes and systems in place. So it is really it's like a mosaic of different departments and different methods and techniques that they are all kind of deploying to design a particular project. But the way it works is that it is the investment operations team, or what we call the project team leaders, who lead the project, and then there's a team that's designing and driving it, and then we have the our environmental and sustainable fiduciary solutions team. We have our the legal team. We have the treasury. We have so all the other teams that are then supporting us in delivering those projects. And of course, the due diligence ranges from financial due diligence in terms of the cost benefit analysis, credit worthiness, to the technical due diligence in terms of engineering feasibility reviews of the kind of infrastructure that's being developed, to the environmental and social due diligence through our environmental impact assessments and our social impact assessments, and to the legal and regulatory due diligence, which is on the compliance checks and the contracts and concession agreement reviews. So it really goes on and on, which is why the processes are they are multi-layered, and there are multiple teams working on these, but they are the highest, they really, MDBs try to follow the highest standard in terms of international best practices. So that's on that front. The second is in terms of let me actually take the third one just as per what is freshest in my memory, the one on leakages and how MDBs check that. I think what is very interesting to see is how the MDBs are able to deal with countries to make sure that the disbursements happen in a very in a timely, accountable, transparent manner, right? So for certain kinds of financing mechanisms, they are disbursement linked to those milestones and to results. So in that case, our teams are literally working hand in hand, side by side with the project, with the PMUs or the project or the PIUs, the implementing entities, to make sure that the project is delivered, and wherever there are challenges, walking with them and guiding them and providing expertise when required. We have every quarter, there are what we call the PIMR reports, so the project implementation monitoring reports that are submitted to the bank, and our teams, different teams, make sure everything is on track. Along with that, we also have what we call a TPRM. So we actually, or rather like a portfolio review and monitoring meetings where we have senior leadership of our MDB or of MDBs with senior leadership of different countries, where they literally sit side by side and they go through. We literally had one recently where they go through the whole list of current projects and discussing where the issues are, why the disbursement hasn't been made, and then making sure that from the central level there is engagement with the states and downwards. Because structurally, when MDBs engage with countries, the counterpart is the Ministry of Finance, and then the line departments that we engage with, and then the country counterparts engage with the states and other stakeholders. So it's really at multiple levels, but just giving this as an example, and we had one TPRM recently. And then to the third question on country action, climate action post the pandemic, I would say in general, of course, the pandemic has speeded up that process, but the Sustainable Development Goals, I think in 2015, that has played such a huge role in bringing education, awareness amongst leadership and governance at the highest level, that countries need to make these commitments, in the short, medium, and long term. We see that now most countries have their NDC documents. They have a lot of other documents in place which are supporting the transition the climate transition. I guess the challenge now is how they're going from paper to ground reality, because there are a lot of these wonderful strategic documents that are there at the country level. But how do countries evolve where climate governance becomes really central, and right from the top to the bottom, there is that training. And along with that, I would also like to add that we see that even the establishment of ministries of environment, climate, in India's case, the MOEFCC, an establishment of such entities in other countries are playing a key role. I think the challenge is climate is intrinsically cross-cutting. So they have to make sure that they are in conversation with all the other sectors. And along with that, making sure that the adaptation and mitigation aspect is also correspondingly addressed. But yes, I mean, definitely in the last decade, there has been huge progress in this space.
Thanks, Vanshika. Dr. Joshi and Antara, if you can quickly answer the two questions in like a rapid fire way.
Okay. I'll try and do this quickly. So it's a great question. Thank you for bringing that up. So philanthropy looks at, I think, access in different ways. Where there's discovery research, typically the data is either made open source or available to other developers as required, because discovery research is, I think that's the nature of discovery research. Where there is product development involved, I think typically what we've seen is philanthropy has a few approaches. One is for the product to be mandated as a public good, either a digital or a non-digital public good. That is not always what every developer is willing to work with. So the second thing that philanthropy then does is in terms of IP, where the IP is either held by the developer, but then licensing is enabled to make sure that the solution is, whatever product solution is accessible to the most vulnerable. The third thing that philanthropy very often does is puts in pricing requirements. And a developer must sign up to a ceiling price, beyond which there will be clawback conditions. So that also ensures access at the product level. And then in terms of, I think, further downstream, very often philanthropy gets involved in either providing volume guarantees, which makes it viable for the private sector to provide accessible pricing at the very outset, rather than wait 5 years for volumes to scale up. Philanthropy, in addition to volume guarantees, also very often provides pricing commitments. And that's typically done in the case of vaccines, which enables developers to make the investments upfront because advanced market commitments have already been made, and part of that funding is available. So I think there are different ways in which it's done.
Thank you, Dr. Joshi. Antara, would you like to quickly answer the question on philanthropy and other, how it can bridge the gap with other sectors?
And how can they engage better, right? That was your question. So yeah, I think, philanthropy, philanthropic institutions, they are independent and they have much more power to work at the grassroots. And that's the reason I said, in the rural areas, I've seen better coordination because they are present where no one else wants to go. And that's the reason, that, they have so much power to make a change. So I think, there are a lot of good practices. If they're working in a bunch of states, I think easiest is to look and engage with other state level subnational governments because it's faster rather than going through the government of India route. Because state level bureaucrats, I've worked with them. I know that they are absolute rock stars when it comes to adaptation and resilience because they like seeing action on ground and implemented. They are very proactive that ways. So that's one thing. They can step into build long-term interventions because a lot of the dialogue right now happens on the impact, the short-term variables. So we throw technology, we throw money, and we think that the problem will dissolve in the next 1 or 2 years. But that's not going to happen. For resilience building, it needs constant, consistent adaptation action for a good number of years to actually build resilience on ground. So that is where philanthropic organizations have definitely an edge to stay engaged for a longer term. And thirdly, supporting impact evaluations, like a lot of us are saying, this data is limited these days on actual whether all the adaptation action that's taking place, whether it's actually building resilience on ground, whether it's actually generating community resilience. I think philanthropic organizations can be independent and they can work together with academia and with research agencies to get those impact evaluations to generate that kind of impact data that can help in, also giving confidence to private sector to come in and finance. I would leave it there. Thanks.
Thank you, Antara. I think we really summed up the three aspects of our panel, of our event today. Risks, philanthropy can take the risk. Resilience, we can build resilience as far as bringing MDB as a community is concerned, or bringing the corporate and the private sector and MDBs together. And resources. We have the resources, I understand from this discussion, and also in the morning that we had. We really have the resources. But how are we going to balance resilience and risks there? So I think it really, this panel really summed up those three elements that with which we started, we planned and, initiated this seminar today. I thank all the three participants for joining us, and for our audience, both virtual and physical, for, being there with us and engaging with us. Thank you so much. And we look forward to having you for our next event as well. Thank you.